And the captions on.
I personally thank you for that option.
Of course, always. All right, we're going to go ahead and get started. Welcome everybody to our August coffee chat. I have to remember what month it is every time. Welcome. All right, we're going to go ahead and we have a packed agenda today, so we're going to jump right in. Like I said, we are recording, and these recordings, excuse me, are public and go up on our YouTube channel. So if you want to watch a coffee chat you missed or rewatch a discussion, you are more than welcome to head over to our YouTube channel and check that out. Our agreements we like to go through before each meeting. A couple of those are, we want this to be a safe space for everybody. So we want to be both teachers and learners. We want to take space and we want to make space for others as well. We'll hear a lot of stories today, I'm sure. So the stories that you hear stay, but the lessons from those stories leave. One person speaking at a time, and we want to, of course, be here and present now. And here's our check-in question. Since we have so many wonderful people on today, I ask that you put your answer to your check-in question in the chat. Excuse me. And I'll let you know. Hi, all. Those of you that don't know, my name is Laura Jackson, and I am the Director of Communities at PFCC Partners. I am located up in Eugene, Oregon, although our offices are down in Long Beach, California. And our check-in question today is, what is your favorite memory of the summer so far? I know summer's almost over, but I'm still living out those last few weeks here. Mine is here, says a picture I took a couple weeks ago. We went out to the coast, and a California girl moving to Oregon, got to go to the coast, and it's just a whole other world on the Oregon coast, and I'm sure Washington coast as well. It's really, really beautiful. So that's a picture I took. And so that is one of my favorite memories so far this summer. So let us know in the chat where you're calling in from and your favorite memory so far of summer. Oh, Jan's been to Norway. Nice. His birthday party. Happy birthday, Roger. Some exciting news. We have core competencies of effective partners coming up. This is one of our skills exchanges. It's all about the 5 core competencies of becoming an effective patient-family partner. So these are the 5 core competencies here. We've got teachable spirit, representative voice, being solution-focused, being constructive collaboration, oh, that was hard for me to say, and establishing partnerships. So it's a 2-part online skills exchange, and we like to call them skills exchanges because we learn just as much as all of you each time. I love attending each one because I learn something new every time. And so that is coming up next month, September 20th and 27th. We'll be sending out the registration link in your email, so make sure to keep an eye out for that. And then we do have an engagement opportunity if you are interested. It's about the SDOH, the Social Drivers of Health. If you've ever been asked about anything like food, housing, or transportation at your doctor's office, and you want to talk about that experience, the Social Interventions Research and Evaluation Network, SIREN Network, is looking to hear your input. They are asking for folks to do a 30 to 45 minute phone or Zoom call interview, and you get $75 for participating in that. To participate, the email is there on the screen here. I will send this out also in follow-up, and there is a post in our online forums with this information as well. Janice Tufty posted it in forums, so you can go check it out there. And I did get a question in the chat as for the core competencies, the curriculum does not change per se. We do change up we give examples of situations and we do change those up. But the general curriculum is still the same. But like I said, we learn something new every time because it's a different group of people every time. And thank you everyone for putting your intros in the chat. All right, I am going to welcome our patient family partners who have engaged in measurement that are here today. And if I can ask those of you that are sharing your experiences today to let us know kind of as your introduction quickly your name, where you're calling in from, and what your favorite or most interesting measurement project you've worked on and why. So I'm going to start at the top of this list, and that's Rosie.
Okay, I'm Rosie Bartella and I come from Wisconsin. And the reason I'm here today is to share a little bit about my experiences with measurement. And I think I've been doing it with healthcare for probably more than 5 or 6 years. I was involved way back when Stephen and I were on a group that was with NQF, and definitely was a challenging group, but definitely learned a lot of things that time. But my background is education, and I did a lot of work in measurement and patient and student outcomes, and redeveloping and looking at how to focus on student outcomes instead of just getting numbers. And so I felt that a lot of that, I feel that a lot of that experience has drifted over to the healthcare side of my life.
Thank you, Rosie. Thanks for sharing and for joining us. And I am excited to hear more about your experiences. Sherry.
I'm Sherry Binns, and I live in southeastern Rhode Island, almost on the open Atlantic coastline. We're about 1.5 miles away. My background is nursing. I think probably the thing that got me really hooked on measure development was back in 1994 when I had to take some time off due to health problems. I did go back to my visiting nurse services where I had been a case manager for years into an in-office position where I was given the task of doing chart audits. And I developed a plan through those chart audits to make sure that our charting was reflecting the continuing ed programs that we were presenting. And specifically, initially starting with wound care, where we measuring the wounds in millimeters instead of the size of a dime or the size of a quarter, so that things were consistent. And over the 1.5 years that I did that, I just saw such an improvement in what people were doing that was following what they had been taught instead of just basically doing their standard notes that weren't really giving a good picture of what was going on. And I think over the years, as I've done more and more measure development, one of the things that has really impressed me is that people who are in charge of these measure developments are listening more to the patient voice, and we're not just tokens anymore.
Thank you so much, Sherry. That's so important.
Yeah.
Important.
I'm
Thank
gonna
you.
use a truck walk. I have all my electronics.
All right. Joe.
Yes, good morning, everybody. It's been a while since I've been able to join you. So I'm Joe Connell. I've been volunteering as a PFA with Sutter Health, which is located in Northern California. They have about 25 affiliates and various other ones, and growing. Big administrative leadership changes going on in the organization. This is about the third in about so many years, about 3 or 4 years that we've had these changes at the administrative level. And so been a part in reinventing PFAs as new people come into the organization with new ideas. And I've been a PFA with Sutter for about 8 years or 7 years after I retired. I too, my background, much like Rosie's, is from educational administration, the Catholic school system, and I ditto her on. It's full of measurements at the administrative level, a lot of bureaucratic measurements for the state, federal. Everybody understands that, but for the patient students that we serve, constantly doing that for self-improvement, not only their educational backgrounds, but also that of staff and administrators. So I have some familiarity with measurement, but not in the context of healthcare until I was asked by Libby and Laura if I would tell my story about prostate health and cancer, and which I've resisted to do, even as a part of this organization and others. I'm just not a storyteller. I'm pretty, quiet and don't talk about these things. But I've learned from everybody like yourself, you got to get over it, Connell, and just get started. So I saw this. I joined with these folks on the right side of the screen, left-hand side of the screen, and was made to feel welcome and coached, particularly Marty. Thanks again, Marty. But so we'll talk more about that, I guess. We've got some questions to kind of guide that discussion, and so I'll be on again.
Thank you so much, Joe. We are so glad you jumped in and joined us in that project. And yeah, so glad you're here today. Thank you.
Am I supposed to talk about more?
Nope, you're good.
Okay, all right.
You're good. You're good. Thank you, Joe. Marty, which I don't think I saw her on the participant list, but Marty, are you here? Does not look like it. I did see Jan.
Yes, hello. I'm Jan Lambert in Salt Lake City, Utah, and I started this journey with Comagine Health. I've been on their PFAC since 2014. That was when it was first developed there. I've had the opportunity to do some really easy measurement development. I've been very interested in patient portals, and I've gotten kind of hooked up with companies that are trying to improve patient portals. But my favorite project probably was I have rheumatoid arthritis, and it was able to participate in a measurement program with CMS about rheumatoid arthritis. So it's the only time I've really gotten to address the needs. I'll pass it on.
Thank you, Jen. You broke up a little bit there at the end, but I think we got the most of it. Thank you, Jan. Again, I don't see Michael on the list. Michael, are you here?
Michael had another meeting during this time.
Yeah, he wasn't sure. So it looks like he went to that other one. Thank you, Sherry. All right, and Mary Schramke.
Everybody, it's Mary Schramke, and along with Joe Connell, I've been a patient family advisor with Sutter Health, and also worked for probably about 7 or 8 years, and also done some work nationally with the CMS, Center for Medicaid and Medicare Services Meaningful Measures Group, as well as some National Quality Forum work that others have done. My favorite measurement project is actually still ongoing, and that is with the Palo Alto Medical Foundation, which is part of Sutter Health. And the reason why I wanted to bring that one up is because one is twofold. They actually have as it turns out, a standardized way to ask patients how you're doing as you are recovering. So it's an important piece of the patient journey, not just going into your doctor's office and checking some vital statistics and having them enter it into your medical record. But there are standardized questions that as you're recovering during this whole process, that there are some standardized questions, particularly around, say, if you have a knee replaced or a hip replaced, for instance. There's a long history of these standardized questions being used. And the reason why I brought that up is when I first saw these standardized questions, I was like rolling my eyes going, oh my God, these are so dry and so boring and yada, yada. So I was like, can we change these to make them more interesting? And the answer was no. Well, the answer was maybe, but we don't want to, because that way we can't compare, across different people and different places, and really use that to see how the care teams are doing in relationship to the patient and how they recover. So I was reminded, I actually have a scientific background, but it's more on the business and research side of science. But there are a couple of things, really basic things about measures. Some of them are what they call quantitative or quantities, so you can count on your hand, 1, 2, 3, 4, 5. And the other ones are qualitative. And those are ones that are asking you about how you are doing or how you're feeling, and you maybe rank them on a scale. And I just think it's really important for people to know that it's important that one, you can get those two to come together. And then even if they are standardized, what we have been doing is working around making the way they're presented more understandable to people of various backgrounds and situations. So these are the things that I think if we, as we think about whether or not we want to be on a measurement team, one, it's important to speak up for how understandable the explanations are. And you can, even if the formats or the types of questions are standardized and a little geeky or dry, you can still work with the team, and this team has been very receptive to it. And, you have to keep looking at it in that lens, and that's where our value is. And then the other thing is to keep asking for both these quantities of things getting measured, as well as what's the quality of how things are going. Oops.
Thank you so much for sharing, Mary. I really appreciate it. And thank you, everybody. And as you all are aware, we have these wonderful folks here joining us today who have participated in these measurement projects that they just talked about. And so we're going to hear a little bit more about their experiences throughout these projects. So Nadine, did you have a question?
Yes, I'm sorry to take time away from your meeting, but I'm very intrigued by what Sherry had to say in particular. And what did she really attribute? Well, she's there. What did you really attribute to better documentation on wound care? Was it just the millimeters versus eyeballing it, or what really got them to do a much better job? Because wound care is really important to me.
Yeah, I think we had done a wound care in service where we discussed documenting the condition of the wound from visit to visit. A lot of our patients were on twice-a-day dressings before we got into the more advanced wound care treatments where you might leave a dressing in place for several days at a time, particularly with the new gel dressings. But so we started asking them to chart in a very specific way. Somebody's not on mute, and
You're
we're
good.
getting background. So we started asking them to measure the wounds, and we provided them with measurement tools that were in millimeters, not inches. And we asked them to stop relating to the size of a wound related to coins, which was old school back when I went to nursing school 50 years ago. And when we weren't seeing on the initial reviews, we would use an ICD-9 code to pull up wound care. So patients that had perhaps decubitus ulcer or pressure sore would have one code. And we looked at all the charts in that code to see if the charting fit. And then we looked to see if the person giving that care was had been at the in-service or had watched the recording of that in-service. And we gave, if they had not been, we gave them a period of, I think it was 10 days or 2 weeks to watch that recording and then follow up with their charting to see if they were doing that. So we had a system in place, which basically I developed with our head of staff development, who was providing the in-services, to make sure that what was presented at the in-service then had a deliverable that we could actually look at and follow. And we did a repeat in-service when we were not getting much better than about 50% on the charting. So I hope that answers your question.
Thank you. Thank you. I so appreciate that. Thank you.
Thank you, Nadine and Sherry. All great information. And again, such important work that you did, Sherry. All right, so we're going to go ahead, excuse me, and get into the discussion. And if you do have any questions for the patient family partners, feel free to add them into the chat, and we've got some time at the end to get to those questions. So our first question for our patient family partners is, what motivated you to participate in measurement? And I've got Mary here at the top of my screen. So Mary, what motivated you to participate in measurement?
Hi, Mary here. Yeah, what my motivations were around really putting my experience and training and background in scientific research and data analysis, putting it in a healthcare setting. I know that it's all you go from one subject matter to another. Like if you talk to somebody who's in finance, or if you talk to somebody doing your taxes, or you talk to somebody who's building a road, the numbers they use and the language they use is all really different. And the numbers are still numbers. So, I mean, to me, I saw a really great opportunity in being able to know a little bit about the discipline of the numbers, but then help people translate it into the situations that patients might find themselves in.
Thank you, Mary. Yeah, it's a great motivation to join measurement. Rosie?
I guess mine kind of goes along with what Mary said. I got involved in research and with also the Department of Health, and both of them did a lot of work around measurement, and in research you would immediately start looking at things from the measurement point of view. And so I really wanted to make sure that the patient's voice and the patient's experiences were part of the measurements. And so I really felt that that voice had to be part of measurement. And so when CMS started looking at measurement and adding the patient's voice, I definitely immediately said, this is where I need to be, because I want that voice to be heard, and I want it to be recognized. And because if we don't put the patient at the center of all of this work, then it's just numbers. And I remember my late husband often saying, Rosie, all they do is give us a list of numbers. And what does that tell us? It doesn't tell us, what the story is, or what, why is it happening, or where can we make improvements? And so, that's another motivator for me, is because I hear his voice. When I hear a list of numbers, I hear his voice saying those things. We need to know why this is happening, not just numbers. I mean, and that's, the infections, when they talk about infections anyway, they always say, well, we're this much better than the other hospital next door, or we're better than the national norm, which is this number. But they don't always, nobody realizes that one infection, like my infection, was probably 0.00001. I wasn't, if you were at 5%, 0.5 doesn't mean that that's a great number. That means that you've probably got a good number of infections.
Thank you, Rosie. Yeah, I think adding the patient voice to data is so important. And I mean, it's a huge motivator for so much of the work that all of us do, and not just in measurement. So thank you, Rosie. How about you, Joe? What motivates you to participate in measurement?
Oh, you're on mute.
Yeah, you're muted, Joe.
And my,
There you go.
thank you much. It's happening increasingly as each day I get older. No. I was motivated, actually gratefully pushed into it because I was asked by Libby and Laura to get involved, and I needed that. And I kind of hinted at that my last time I shared the screen with you. And I also wanted this little theme of here, quantity and quality. I guess I've never heard it expressed that way on measurement. When this kind of was introduced to PFCC partners, that those are the two essential measurement. You roll your eyes and say, much like some of the stuff that's being talked about already, say, oh yeah, God, I never was good at math, and I just can't get involved. Another excuse for not telling my story. And but I like the quality thing, and I found that I could fit into that and perhaps be a better participant. And then I thought about it, and I finally convinced myself I do have a story to tell, and perhaps I ought to tell it. And so getting involved and jumping at the opportunity with the coaching I got from this organization, I'm glad I did.
We are too, and so happy to be your motivation. But also, I'm happy that you telling your story is a huge motivator to you, and I'm glad you did.
I would recommend, maybe this is standard talk, but I've never considered the quality aspect, as Mary talked about it, as equally valid as the quantitative.
Absolutely.
And it makes so much sense. And I learned something.
Good. I'm so glad. I love when people learn things, myself included. Thank you, Joe. Sherry, what motivated you to participate in measurement?
Actually, I was sort of pushed into it. It wasn't something I would have chosen. I always hated statistics. I was much more a quality of life person, but the fact was my MS had gotten to the point where I really couldn't do the field work that I had been doing. It had me driving 90 to 100 miles a day, seeing 6 to 8 patients every single day. And that meant that my work days, as my fatigue level went up and my cognitive level went down, was really compounding things. And so that was my only choice to stay in my job, was to completely change the focus. But it was exciting to see, as I was doing chart reviews, some of the charts were ones that I had been charting on, and I was noting the discouragement that my patients were having, that their wounds weren't healing, that they had to be on tap twice a day in a time frame. So it was essentially putting them at home for 4 hours or 2 hours in the morning and 2 hours in the late afternoon, early evening, for a nurse to come and change their dressing, which meant that they couldn't make an appointment for a doctor's appointment when the doctor was available, or they couldn't make an appointment to get their hair cut or something like that. So their quality of life was diminishing. And when you're able to see that an intervention, a different manner perhaps of doing that wound care, so that there was a lower frequency of engagement with the patient, but a higher level of appreciation for the freedom that lower frequency gave. you could just really see a tangible connection between quantity and quality. And I think once you can really see that and grasp the importance of the impact that that quality quantity balance has, it just fuels that desire to expand that reach. And Nadine has her hand up again.
I'm sorry for picking on you, but I'm very curious to know, it's such an interesting concept. I'm just visualizing this in my head as a patient. Does that put more of the onus on the patient to be doing more surveillance on their own wound care to offset the less surveillance by a clinician?
No, I don't think so. In the home care environment, many of our wounds, whether they were bed sores or whether they were diabetic ulcers or something like that, we're getting a regular, twice a day wet to dry dressing at that point. And when we started hearing the fact that patients were feeling trapped by the schedule to care for their wounds and not seeing the progress with the wound care, it really put the impetus on us as case managers and as an organization to start researching perhaps newer methods of wound care that that were not that might have been more costly
but less intrusive.
Less intrusive. And we had one gentleman that he also had multiple sclerosis, and he was either bed or wheelchair bound. And so he had a couple of pretty significant pressure ulcers that we had been dressing for 2.5 years, and they hadn't showed significant improvement. And so this gentleman was on, I was temporarily assigned to be his case manager, because the nurse that was caring for him and had been for 2.5 years had felt like she was no longer an effective person to him for his care because of personality and outcomes. And so they assigned him to me, and I really did some extensive research on wound care and discovered a new, more expensive gel dressing that would stay in place for up to 5 days if there wasn't too much drainage. And over the course of about 6 months, we saw his wound stop draining and begin to granulate or have some healing around it. And it halved in size, and the tracts in 2 of the ulcers closed up completely. So the new wound care was really helpful, and he was just delighted because it gave him the opportunity to actually be available to friends to come in and visit without having to exclude them to another part of the house or the backyard while his wound care was being done, which was very time consuming. But this newer method that I found not only healed the wound more quickly, but it took much less time in the administration of it. So I hope that answers. You. Okay.
Thank you, Sherry. Thanks for sharing. Jan, I know your internet's a little funky, but are you able to share what motivated you to participate in measurement?
I'm not going to turn on my video. Maybe that will help. I don't know what happened. And I'm sorry, I don't know exactly what's been said, but probably as most, my concern is that we get our best use of our dollars for our healthcare. And I felt like I was seeing waste in places that we could improve. And so that was one of my motivations, was to try to help our system, since we have a very inefficient and expensive healthcare system, to hopefully make it more efficient and more patient-oriented. So that was one of my main motivations. And when I found out that patients could actually participate, it was such a great opportunity. So that's kind of motivated mine is trying to help make our system more efficient and more specifically by using patients to find out what is working best, helping patients best.
Thank you so much, Jan. I love hearing the different motivations you all have. They're all different yet similar in terms of motivation, and everything from people who love the numbers to people who love the qualitative data to adding the patient voice. I think having the patient voice in measurement is a motivator for all of us, and that's why we're here. And so I appreciate you all sharing your motivations. And the next question is, what challenges did you experience when participating in measurement? As we know, measurement is not the easiest thing to try to understand. At least for me, it's hard to understand measurement. And again, it's the numbers and the statistics. And like many of you, I was never good at math either. So I can imagine there's quite a few challenges when participating in measurement. Mary, what kind of challenges did you experience?
This is Mary. Challenges were, I think, people on the team had different technical backgrounds, and some of them were, say, research scientists, and some of them were clinicians. Some of them were, patient advisors. And like I was mentioning before, we all had, different perspectives. We kind of were in our own little weedy zone, what they say. You get in the weeds or you're wandering around the grass. And what was difficult at first was trying to understand where they were coming from, what's their perspective. And when I at first it was hard. I always want to listen and learn, and at first it was hard to know. Like I said, there are different languages that are being spoken, even if they're talking about the same topic, because they have different expertise. So that was one of my biggest challenges. But I think just being able to ask questions and not being afraid to ask is that's probably not exactly. We'll go down that road a little bit later, but that's just one thing I can't emphasize enough is it's no stupid question.
Absolutely, and agreed. Measurement can be a completely different language, and asking questions is so important. Thank you, Mary. Joe, what challenges did you experience when participating?
The challenge never went away. Once I got over my anxieties about the whole experience, I didn't really understand the audience that I was addressing, and or who bottom line wanted my patient's voice. And it was definitely, well, the volunteers that we from PFAC were contributing, were definitely the patient's voice, and definitely qualitative. But so what? What are the end results and how do we fit in? I knew we were appreciated because they were only, most urologists. Mine was prostate cancer, so there were urologists there, and there were finance people there. There was other kind of people there, all trying to narrow down payment schedules or reimbursement schedules in the area of urology. Well, oh hum, that's nice. But I think what we did, but it was not made clear at the beginning, they wanted to hear from folks like us about the soft side of their job as financiers or administrators or whatever, in order to get the latest payment scales or for reimbursement to urologists for whatever they do. So, but that part was missing. And maybe for people like me who need to know where are we going with all this before they jump in, this was never quite fulfilled. And I would say future people, if we can have this done again, that be made clearer more. And or the people ask, how you coming? Do you understand how you fit in here? But you know how it goes. That was a constant challenge, but I felt I got good coaching throughout the experience from folks like that are on this call, and Libby and yourself.
Yeah, I think that challenge is pretty prevalent in measurement with, because I feel like a lot of the work we do in measurement, you don't see the results or the impact as quickly as we would like. I think it's something that we impact that is for that, something that they work on for a very long time, and we are part of that. And that's totally a challenge in measurement for sure. Thank you, Joe. Rosie, what challenges did you?
I think you're absolutely right, Laura, in that that's one of the challenges. I think that because we're many times driven by, we want to see action and it doesn't happen that fast. One of the first measurement groups I had was exactly 5 years ago, and we're starting to wrap it up now. And we're starting to see some results now. And every so often I'm like, oh, I thought that was done a long time ago. And then all of a sudden I get an email and it'll say, we're having a meeting to discuss how, because remember, we create the measurement and then they try it on people, or they try it in healthcare settings, and so that's one of the challenges. I think also one of the challenges is, and Dorothy is on the call and I see this, she and I ran into a situation where we were probably on the call the whole time, and you were there too, Laura, and it was like they didn't want to hear. I don't know why they wanted us there, because they didn't want to hear from us, and they didn't see the value in hearing the story, because they were all about the codes and how is that going to be paid, and yet if you don't have the story and you don't understand, and I heard clinicians saying that, and clinicians wanting to hear the stories, and they had stories, but on the other side, the people that were involved with the organizing of it didn't want to hear the stories, and it was like they had a different agenda than we had. And that was how it started out maybe 6-7 years ago when I started with this, that there was the agenda where you only got to vote, you didn't get to speak, you only voted on polls and things. But that had changed, and I remember and I've been involved with other cost measurement things where I remember a big discussion in a group about sepsis, and if you're being transferred from one hospital to another hospital and then you end up dying, who's responsible for your death? And I'm like, well, wait a minute, I have a story to tell about this. And I'm going to tell you that neither the hospital I was transferred from nor the hospital I went to would have been responsible if I died in flight or if I died at either one of them, because the responsibility really started 5 or 6 years earlier. When I got this infection, that is the responsibility. Just because I've been readmitted a multiple of times to multiple hospitals doesn't mean that, that any of them would have been responsible for my death. Because, basically the little hospital that I was taken to and then flighted to another hospital, they did everything they did right. And then they made sure, and when I got to the next the teaching hospital, they did everything right. I'm here because of that little hospital. I'm not here because of, because I don't believe I would have survived without what they did at the little hospital. So, that sometimes they forget that there's bigger challenges to measurement than just the people that fit into a certain box. And they have to look at, and right now I've had a couple situations where I've been involved in measurement where they talk about the complications and what happens if there's a complication. Do you want to know how they get paid for complications? And I have to tell you, first of all, when you're in the middle of a complication, you don't care how they get paid. You just want you want to survive. But I think that those are kind of the challenges you know, as we go through this, and as the patient's voice keeps being added to more and more measurement, there's going to always be challenges. And we have to make sure that we don't lose our voice in the middle of it.
Absolutely. Thank you, Rosie. Roger, I see you've got your hand up. Oh.
Yep. Hey, and I'm just probably going to echo everybody else. I think for me, you know, I started off many, many years ago, back in the early days of the AIDS epidemic, where, you know, the challenges were just seeing somebody or getting in the door was a challenge. But I learned earlier on that once you get in and you develop that relationship and stuff like that, you know, things work out much, much better. And, you know, you can overcome most of the challenges. I think one of them that I feel sometimes doing some of these is that sometimes people don't really respect the fact that patients' voice is important. You know, sometimes people are like, well, you know, we're doing it because we have to do it, not because we want to do it. So it's running up against people that are really probably stubborn or something like that. So I think that would be one of the challenges, and just having people when you ask questions when you don't understand things, where, you know, when you get like an answer that's not really fulfilling enough, or they don't answer the question because they're just like, well, you know, but you know, I love getting into measurements. It's something new for me, and you know, I participate on some PI committees and quality committees, so it's just a normal for me to be able to want to do more in this area.
It's the next step, Roger.
Yeah, and that's what I'm doing. I'm taking that next step. So thank you.
Great. I'm glad you are. Thank you so much, Roger. Sherry?
Sorry, I'm trying to get off of mute. Before we go on to the next question, I think I have a comment on what the second question was about the challenges in participating. And I think it boils down to education. The patient often doesn't know who is the responsible party, who is the person that should be intervening on their behalf. And it's generally not the doctor. And I think too often the patient will hold the medical team or the doctor responsible, particularly as it relates to wound care. The doctors know nothing about wound care. It's the nurses who do, and it's the nurses who develop those plans. And I think education is really important. And I think we need to learn how to address that patient voice and the patient concerns with the appropriate team member. And so that was probably my biggest challenge, is the educational component of, you know, your doctor doesn't really know wound care, and you need to let me research this and educate your doctor so that he orders what it is you need. And so I think, you know, we need to get into that interactive dialogue that has an educational component to it.
Great. Yeah, I like that idea of that interactive dialogue, so that it's more of a conversation than us sharing our stories to data people. And speaking different languages, that's the best way to come together, I think. Thank you, Sherry. Jan, can you describe your overall experience while working on a measurement project?
Yeah, you know, like has been said, my biggest problem was always confidence. Confidence that what I had to say was important, that it would be taken seriously. And then I realized it's really not my problem to make me feel comfortable in this environment. It's their problem. You know, and so my best experiences have been when they make me feel really as part of the team, that what I have to say is valid and important and pertinent to the questions that are at hand. So I think we need to remember that it's they need to set up the program so that we do feel confident and positive in that experience.
Great. Thank you so much, Jan. I think, yeah, confidence is key when it comes to sharing our stories in measurement and yeah, and owning you are the expert to your own story. So thank you so much, Jan. Sherry or Joe, either one of you, would you like to describe your overall experience working on a measurement project?
I just ticked something into the chat, and I'm saying maybe problem related to what Jan was just saying isn't the word that we need to be utilizing, but responsibility. Who's responsible in the equation to keep problems from developing? And I think it's just being open to a conversation that allows us to identify the responsible individual or group to keep that problem from developing, or to help the problem to be recoverable with the interventions that are developed.
Absolutely.
So again, it's being open to viewpoints other than one's own.
Mm-hmm. Great point, Sherry.
I would add to that. I think going forward, as I've learned more in this last hour about what I was doing and where all this was going than I did for the number of meetings I had with the group I was representing, who were benefiting from the patient's voice. I don't know what they contributed to that end, but I got more out of it today's. So I would say that overall, the positive, I've learned so much. I've learned more here than I did during the actual progress. And I now would do it again from what I've gained. And but the burden is on the people who are requesting the patient's voice, that qualitative side. And maybe they need some in-servicing from the people who ask us to be involved.
Mm-hmm. Thank you, Joe.
But generally fine. I did not ever say I want to do it again, but I did.
Glad you did, and glad you're here today. And I'm so glad that you're learning lots. I think that's great. And I'm going to go ahead and go to this last question, and then we will get to last 5 minutes Q&A. But I'm curious, Mary, were there any specific aspects of the measurement project that you found interesting or eye-opening?
Sure, this is Mary. The one thing that I found that seemed to keep happening over and over is that a lot of times when folks are trying to measure something, it's about, like, they have it fenced in from their part of where they operate in terms of healthcare. And I constantly am amazed at how easy it is for folks to forget that this is about the whole journey of what a patient is experiencing. I mean, it starts at, say, preventing an illness, or maybe there's a change in their health, or then they show up at the front door of the emergency room, and then they get a diagnosis, and then they get treated, and then they have to live with it. They have to recover, and then maybe there's some stage of their life. So the whole patient journey piece, I think, to me, is probably one of the most important and eye-opening things that happens over and over, is that that's where you can, even if you don't understand the data and the methodology and everything else, is to just keep bringing them back to, this is not just one small piece of the puzzle, but there's a bigger 1,000-piece puzzle that we're working on here, and it's not just the corner over here that you're working on. It's eye-opening, but yet it's to me, it's encouraging, because it keeps reminding me that I need to keep showing up.
Thank you so much, Mary. And I wish we could hear from all 5 of you about the interesting and eye-opening aspects, but Fortunately, we're running out of time. We've gotten so much information from you all so far. I do want to get to a question or two. Barbara Lewis has got her hand up. Barbara, feel free to take it
Oh,
away.
thank you. This has been great. Really very interesting. I had a comment and then a question.
Sure.
So I was on a measurement committee, a group, and there were a lot of statistics, and I was taking statistics at the time, and I couldn't understand it. I took the statistics to my statistics professor, and he couldn't understand it. So I contacted them and I said, look, I don't really understand what's going on here. And I'm sort of lost in the meeting. And rather than asking questions in the meeting, what I did is I asked them if they would have a pre-meeting for patients, which they agreed to do. And this is a CMS group. And that was really beneficial. So in addition to asking questions, you might want to ask if there can be a pre-meeting. So the question that I had was concerning more PFACs than what sounds like these measurement groups. So many of them are government measurement groups. But I was curious if you've ever participated in a PFAC with measurements before and after an initiative.
Interesting. Have any of you?
Miss Mary, I have, and I think that, Barbara, that's one of the things that, as a patient family advisor, and I am grateful for folks at Sutter Health to do this, is because we have a fairly well-organized Office of Patient Experience and they organize us as PFAs, we're actually able to get in on the study design, kind of like while they're thinking about what they're going to measure. And that sort of thing it's not just before and after they do the measures, but what they're going to measure and how they're going to measure it and who they're going to ask. These are the sorts of things that, I've been involved with, whether it's quality or safety or patient reported outcome measures. Those are the sorts of things as PFAs, if we can keep, raising our hands, and when they ask us and it ends up being the tail end of the project, see if there's ways that we can start from the beginning. And it may not be this project, but maybe it'll be the next one, because the people that you work with will go, oh yeah, we should have thought of that. So anyway, that's one suggestion.
Thank you, Mary.
Thank you. Rosie?
I agree with Mary, and I also have been involved with, but again, it's in an organization where I am involved on the ground floor in all of, it's like from day one when they decide to start looking at a situation and want to measure it. I'm involved with measuring it, and then I'm involved with measuring it after we do the quality improvement. So basically, here's where we are and what the numbers look like. Here's the quality improvement projects we're going to, how we're going to attack this. And then we remeasure it and how does that, what happens. And that happened to me out of the gate right away with a healthcare system. And so that then made me always want to know, did my sharing of my story make a difference or didn't? And I wanted to know the numbers.
Yeah, I'm sure it made a difference. Can you share what the measurement was about?
The first one was about infection, healthcare acquired infections. And basically they were at 0.7 and within a year's time, we were at a 0.2.
Oh, wow.
And basically they told my story to every employee and every orientation. They still use my story to this day. That was 12 years ago, and to this day they still use that IHI video and show it. And I mean, people will call me all the time and say, I just started here and they showed your video, and I'm like, oh my God, that video is so old, but it still has the same points, and it still makes the same points, and it puts a person's voice there from the first moment that they start working.
Right. Yeah. Thank you for that. You've made a big difference. You've made a difference.
It makes a big difference about healthcare acquired infections.
Thank you, Rosie.
Thank you, Rosie, and thank you, Barbara. And if anybody has additional questions about engaging in measurement or measurement in general, I put my email there in the chat. You're more than welcome to reach out and I can also reach out to these 5 folks who have shared today to
Yeah.
get your questions answered. But I do want to wrap up since we're just past the hour here. There is one opportunity, Mary actually sent this over the other day, to learn a little bit more about measurement. The Partnership for Quality Measurement is holding an informational webinar on September 15th from 12 to 1:30 Eastern. I'm going to put the link to register for that in the chat there, but it's about submitting measures to Battelle. So if you would like to participate in that webinar, again, that link to register is there, and you can learn a little bit more about measurement from Battelle. So I'm going to go ahead and close it out. If you have a topic or something you would like, a project you'd like to share with the PFA network and do a coffee chat, my email is there on screen. And again, I added it into the chat. So you can reach out to me and we will get you set up for a coffee chat in the future. We are closing in on the end of the year this year in terms of months. So if you would like to do a coffee chat in the next few months, please reach out and we'll get you set up. And that is all. Thank you everybody for joining us today.
Bye, everybody.
Everyone.